So Mr. Mazid, 72-year, is having advanced carcinoma of lung. He is in the extremely severe respiratory distress of medical MRC grading of 6. Treating palliative care physician decides to increase the dose of morphine, which is an opioid, strongest opioid in existence, to give pain relief by at least 50%. The junior expresses his apprehension that the morphine in such a high doses will shorten the patient's life. What is the ethical dilemma here and how will you solve it? So let's discuss this. A person who is already having a terminal illness, he is having a severe respiratory MRC grade 4 and above, okay, 6 and above. Okay, the dose of morphine is an opioid which may cause pain relief, that is analgesia. It will cause respiratory depression, okay, and pain relief and respiratory depression is going to be definitely to be there. So the treating physician who has decided which principle he is going to follow. So the principle he can follow is a titration of dose of opioid, okay, so that dyspnea, that is the restlessness or breathlessness which person is experiencing, can be relieved, because he has decided the goals of this patient's care: autonomy, beneficence, justice and non-maleficence. So the subordinate who is questioning the decision of palliative care physician, she or he need to understand first this morphine is going to benefit the patient in the form of pain relief, and this pain relief will also decrease the breathlessness. So if there is a disagreement, it can be due to not understanding the consequences, not understanding the full effect of morphine, okay, and because of that one has to be discussing or should resolving this conflict with proper discussion. Okay, consider the natural history of disease, consider the pharmacology of the given agent to the patient, explain it to the patient, caregiver, physician, nurses and your colleagues that how it is going to improve the quality of current condition. Okay, so here the morphine is given as per the benefit, as benefit is more, there is no harm. Okay, also they have access to the naloxone. Okay, he is a trained palliative care physician, and pain is going to cause a vicious cycle of dyspnea. So if they are going to decrease the pain, definitely they are going to improve the dyspnea also. Dyspnea will decrease. Also, this will lead to more satisfaction towards the treatment. So sometimes it can happen. So you can face the conflict. You yourself as a treating physician can face a conflict that if I do increase a dose, will it lead to somnolence or excessive sleepiness, or is it going to harm the patient, or is it going to benefit the patient? And that time shared decision making or act of beneficence, good intention, okay, non-maleficence are going to justify your act. Okay, so suitable method here in this case study was remaining still morphine. Okay, and this morphine is going to help to decrease the dyspnea and pain as well. Okay, so we have seen this effect, we have used this effect, and case study was, that is why put here. So how to solve this kind of ethical dilemmas? So you can solve this dilemma by reviewing the existing information. Okay, if your existing information is proper, then you can resolve it. If you still do not have proper information, acquire new information, existing resources from the resources, analyze it for the rights, duties, consequences, see more number of cases, and see if they have been resolved. Fine tune it, customize it, make it personalized for that patient. Okay, and then go for it. But if at all you think that there are no proper evidences, okay, the response will be completely determined by lack of evidence. So that time you can simply go for another method